Starting this month, healthcare coverage for new moms will go from 60 days after birth to a full 12 months. Health policy experts and doctors here in Richmond say that will help keep moms who have health risks alive during a vulnerable time.
A lot of women are still dying from pregnancy-related complications after their coverage ends. And so we want to get women in care, keep them in care, not make them change health plans 2 months after having a baby.
Sarah Cariano works with new moms on Medicaid. She says extended coverage means more protection from postpartum health issues.
Medicaid and FAMOUS cover a third of the births in Virginia. And so this is really going to impact a lot of women. And a lot of these women previously just after 60 days didn't have access to care because they didn't have coverage.
According to the Virginia Department of Health, more than half of pregnancy-related deaths happened 43 days or more after the end of pregnancy. In Virginia, the mortality rate among Black mothers is more than 2 times higher than the mortality rate among white mothers.
There's always the stigma, especially when it comes to Black women. As soon as we go in there, the condition, the color of our skin already puts us at a higher risk than other people. But one of the biggest concerns is that providers don't listen to what they have to say, or they don't feel comfortable telling their providers.
Non-English speakers and immigrants also at high risk.
The unfortunate truth is that a lot of our patients that are on Medicaid have lower socioeconomic status. They have a lot more reasons to feel a lot more stressed, unsupported. They might have to get back to work sooner than a lot of our other moms. And this might cause them to lose that access and lose the ability to recognize if there's something medically related that's going on and not see a physician because they are continuing with normal life.
The folks who are most vulnerable across the board, who have the largest disparities, are also the most likely not to know about the coverage or to be a little nervous to enroll in it because they don't want it to impact immigration status or immigration proceedings.
The expansion covers everything from regular checkups to substance abuse disorders to postpartum depression care, something Dr. Tamisha Lambert-Giles sees firsthand at VCU.
We're seeing moms, again, with heart disease, cardiomyopathy that might be developing, as well as, unfortunately, mental health, suicide being one of the things that are increasing. I think Medicaid expansion allows us to tackle all of those things, but most importantly, getting preventative medicine to patients so that the overall patient is healthier and we can get a community that's healthier.
Their health care coverage after that 60-day mark can reapply to be covered for the remainder of the 12 months. Children who are also born to moms on Medicaid will be covered for a full year. Working for you in Richmond, I'm Elizabeth Holmes, CBS 6 News.